Hello class, today Laura and I will be talking about a diuretic called furosemide. Furosemide is the generic name of this drug and its trade name is Lasix. As mentioned earlier, furosemide is a diuretic, a drug type that adjusts the volume and/or composition of body fluids. It is specifically a loop diuretic, which plays a part in its mechanism of action. The indications for a diuretic like furosemide are edema due to heart failure, hepatic impairments, which is impaired liver function, or renal failure, and hypertension, which is high blood pressure. Diuretics in general block sodium reabsorption. This sends more sodium ions to the urine, which causes water and other ions such as chloride, magnesium, potassium, and calcium to be excreted by the kidney. The increased excretion of fluids from the kidney results in a larger volume of urination, which is known as diuresis. This is especially true for furosemide because it is a loop diuretic. Loop diuretics inhibit the reabsorption of sodium and chloride from the loop of Henle and the distal renal tubule, which induces large increases in urine output. For the pharmacokinetics of furosemide, 60 to 67% of the dose is absorbed in both oral and IM administrations of it. It is distributed to most tissues, crosses the placenta, can be secreted in breast milk, and 95% bound to plasma proteins. Small amounts of it are metabolized by the liver, and some of the drugs is excreted by the kidneys unchanged in the urine. Furosemide can be administered orally and through IV and IM injections. Dosage ranges for oral administration is initially 20 to 80 milligrams a day as a single dose, though it may be repeated in 6 to 8 hours. The dose can also increase by 20 to 40 milligrams every 6 to 8 hours until there is a desired response. Individuals with hypertension can have an oral dose of 40 milligrams twice a day initially, which can be further adjusted based on response. IM and IV routes have doses of 20 to 40 milligrams that can be repeated in 1 to 2 hours and increased by 20 milligrams until response is obtained. Oral furosemide medication has an onset of 30 to 60 minutes, a peak of 1 to 2 hours, and a duration of 6 to 8 hours. An IM injection onset is 10 to 30 minutes and its duration is 4 to 8 hours, but its peak is unknown. IV administration has an onset of 5 minutes, peak of 30, and duration of 2 hours. The half-life of furosemide is about 30 to 60 minutes, though it can be increased in patients with renal impairment.
Let's move on to contraindications for the use of furosemide. It's contraindicated in hypersensitivity, hepatic coma, which is the altered state of consciousness as a result of liver failure, as well as anuria, which is the failure of the kidneys to produce urine. When considering drug interactions, furosemide may have cross-sensitivity with the use of thiazides and sulfonamides. As well, it can cause an increased risk of hypotension with hypertensives, nitrates, or alcohol. Liquid products that may contain alcohol should be avoided in patients with an alcohol intolerance. Furosemide causes increased risk of hypokalemia when used with other diuretics, amphotericin B, stimulant laxatives, and corticosteroids. It has a decreased effect when given at the same time as sucralfate, cholestyramine, or cholestyramine. Due to the nature of this diuretic, many essential electrolytes, vitamins, and minerals are lost through increased urine output, which can put the patient at risk for common adverse side effects. These include dehydration, hypocalcemia, hypochloremia, hypokalemia, hypomagnesemia, hyponatremia, hypovolemia, and metabolic alkalosis. As nursing students administering furosemide in our clinical settings, we need to be aware of the nursing implications for this medication. First, we need to consider that the use of diuretics is associated with an increased risk for falls in older adults. So we need to assess fall risk and implement fall prevention strategies before beginning this therapy. We should assess for allergies to sulfonamides and should monitor our patient's blood pressure before and during administration. As well, we should assess their skin for rash frequently during therapy, discontinuing at the first sign of rash as it may be life-threatening. Finally, we need to assess their fluid status. This is by monitoring their daily weight, their ins and out ratios, the amount or location of edema, their lung sounds, skin turgor, and mucous membranes. Thank you so much for your attention today in our presentation. We hope you understand the role of furosemide and diuretics a bit more and are able to implement what you've learned today into your clinical settings.